We know that the average American is struggling, and I've dealt with this as a pharmacist. Do I pay for my meds, my food, or my rent, or my housing? That's not a question that someone should have to ask, especially when you're seeing in the news, a drug that was made for $6 is being charged at $6,000, and all of that is just essentially fluff, profit.
Welcome to Benefits Broker Boost, the show that gives employee benefits brokers practical strategies to grow, scale, and streamline their business. Presented by Plansight, where innovation meets efficiency in employee benefits. Now, let's dive in.
Welcome to another episode of Benefits Broker Boost. I'm joined today by Dr. Jonathon Harrison. Jonathon, thanks for joining us today.
Pleasure to be here.
Jonathon is CEO and founder of Wellyfe. We're going to get into exactly what that is, but this is going to be a really valuable episode for brokers. Jonathon has built a really interesting PBM model that helps brokers both win business and also keep costs as affordable as possible for their clients. So I'm really, really excited about getting into this. It's different than anything that we've done so far. Jonathon, give us a little bit of background on yourself, on the company, brief high level, because we'll get into the weeds a little bit as we go, but give us that background real quick.
Yeah, of course. So pharmacist by training. I've been a pharmacist for a little over a decade, and I've done probably a little everything in pharmacy, whether that's your traditional retail pharmacist on the corner to specialty infusion pharmacy, director of pharmacy for federally qualified health centers. I've done a stint as a benefits broker in terms of pharmacy benefits and helping kind of manage that as a technical resource, and really kind of put my time together and thinking about, kind of thought process that stemmed back in college, which was, why do we need PBMs? And I knew the answer was we didn't. However, I didn't know how we could build something different. And that's what Wellyfe is. It's a different model that is kind of what I consider a win-win-win. Not only does the broker win, not only does the employee and the employer win, but also the community members of that organization win. Because we really are a community-centric, mission-based organization trying to build a healthier community health.
Awesome. And we're gonna dive into that a little bit deeper, but there's a lot to unpack in what you just said. Let's start with what's fundamentally broken about PBMs, the traditional PBM model, and why is Wellyfe's, or how is Wellyfe's approach so different?
Yeah, I think at the core, the traditional PBM model is misaligned, right? So when we think about it, PBMs make more money when drug prices go up through spread pricing, through rebates and opaque fees that they have, whether it's a prior authorization fee, whether it's a second line peer-to-peer fee, while employers, hospitals, and patients are told that higher costs are just unavoidable, right? It's just a system that's built on financial complexity instead of clinical value for essentially, communities. It's just, PBMs are taking and extracting value from these communities rather than really putting a ton of value back or value add, right? When you take a look at how much some of these organizations are making proportionally to the work that they're doing, it's just misaligned. So, what makes Wellyfe different is essentially we're taking these hospitals, FQHCs, and organizations and making them their own local community PBM. Well, what does that really mean? Well, the adjudication of the claims is still happening. Prior authorizations are still happening that are safety-based, not necessarily cost-based. Clinical services are still happening. Customer service is still happening. And at the end of the day, what we're noticing is that these organizations can reduce costs significantly because we're using wholesale acquisition cost pricing versus the traditional AWP model. And, right, we're funneling those funds back into the community rather than extracting them to a different state. Right? It's not going 3,000, 4,000 miles away to some headquartered facility. It really is staying in the local community as much as possible.
Yeah. So let's break that down one step further, all the way to operationally and financially for both those FQHCs, but also what it means for others in the community, right? You described to me that these FQHCs, when they become their own PBM, they save massive amounts of money for themselves, but then that's also something that other companies in the community are able to piggyback off of. So let's break that down one step further and walk me through how that works operationally.
Of course. So operationally, we're talking about when kind of phase one, right? The FQHC or hospital health system becomes their own PBM. Their first client is themselves. They're going to use their own employee benefit program as their first client. And by that, they can save up to 60% off of their pharmacy benefit spend. Sometimes we're walking into these meetings and having conversations with CFOs, and they're just like, this isn't believable. And then we go into the data, which we do a deeper dive, right? We show line by line where we're getting these savings from, and the CFOs are just mind blown about how much we're actually able to put back in their pockets, something that they can use to expand services or, take care of their employees. The second piece is kind of that commercialization of this program. So once the PBM is set up, right, we can essentially sell it to other self-funded community employers so that these organizations can share in that savings. So up to 60%. Also, while they're putting more revenue into the hospital, FQHC, or health system's pocket, which allows them to be, just a better facility. They're able to reinvest into maybe their infrastructure, their people, again, all going back into that community. Because what we're seeing across the country is, independent pharmacies, we're seeing critical access hospitals, we're seeing FQHCs have to close their doors or whittle back their services because of financial pressures. And, we're tired of waiting for the government or legislation to really get involved to kind of have this PBM reform that we decided we're just going to do it ourselves.
That's awesome. Okay, now next step. So I always tell people that are guests on here, I want brokers to walk away with something that they can do tomorrow to better their business, right? They're taking time out of their day to watch it, maybe 40 minutes. I want them to walk away with something practical that they can do tomorrow. So brokers are always looking for ways to win new business, to become BOR for new businesses. How does bringing Wellyfe into the conversation help a broker differentiate themselves and win new businesses in the healthcare?
100%. Well, most brokers, when they walk into a client or a prospecting meeting, they're walking in with spreadsheets. They're walking in with Excel, they're walking with paper or spreadsheets. Whereas Wellyfe lets them walk in with a strategy. Because again, this isn't necessarily just something about cost savings and cost reduction. This is also revenue producing for this organization. So you have a strategy that kind of kills two birds with one stone, right? We're able to reduce cost while also saying, we're going to use this as a tactic and a strategy to go get new revenue for you. That's not something any other broker, my time as a benefits broker, I never heard about that, right? You never heard, I'm going to produce new revenue for you. We've only heard, I'm going to produce savings for you. We're going to look at your claims data. We're going to look at your PBM. We're going to look at this. We're going to look at, point solutions that will create savings. Not once have I heard, we're going to talk about a strategy that's going to create new revenue. And if you win a BOR on new strategy to build in new revenue, it's going to be hard to unseat you.
Yeah. So the strategy here is start with the health centers that can become those PBMs, help them switch to that model. They save money on their own costs, but then start this revenue generation when other self-funded businesses in the community also use them as their PBM. And now as a broker, you can go to those other self-funded businesses in the community and say, hey, we have a local PBM that's going to save you X amount of dollars. Here's how that works. And so you've kind of got this now network that you've created, and you've added this tremendous value to each of them. You're right. That's going to be something that is difficult to unseat as a broker. So I love that idea. And it's not something, you're right, that pretty much anyone else is doing. So walk us through the process of this. Let's say a broker decides tomorrow that they want to do this and they've identified a few of these FQHCs that they want to go and pitch this to. What's the timeline? How long does it take for them to become their own PBM? Does Wellyfe help with that whole process? Like, what does that actually practically look like? If I'm a broker watching this, I'm like, yeah, let's go.
So it looks like your traditional PBM switch, right? 90 to 120-day implementation. That's it.
Okay. That includes getting the health center qualified to be their own PBM.
100%. So
Wow.
Wellyfe is doing all of that work. So when we talk about turning them into their own PBM, it's basically on, I wouldn't say on paper, but it's a white labeled solution at that point. So hospital X, Y, and Z or FQHC X, Y, and Z is their own PBM, but we're running all of the things in the background. And the reason why we do that is because these organizations don't have hundreds of millions of dollars to dump into the infrastructure required, right? So like when you take a look at some of these larger hospital systems who have become their own PBM, they have money to put into a lot of pharmacists, a huge call center, right? The P&T committee and all the different physicians that are needed for that, for just P&T and as well as peer-to-peers. We essentially do all that work for these organizations because we understand the position that they're in, right? They need to be able to use this strategy for good, but don't have the funds up front to be able to support that.
Yeah. That makes a lot of sense. Um, for brokers who have self-funded employers that they're working with, walk us through like realistic savings when a local hospital or FQHC becomes the PBM and they make that switch over for their self-funded clients.
As anything in the PBM industry, it's going to depend on utilization, right? When we take a look at two different groups, we're looking at two different groups because we might have higher utilization of specialty in one, higher utilization of cancer medications in another. So conservatively, realistically, we're looking to 30 to 40% savings for those external employers, whereas the hospital is still getting that 50 to 60% savings. And the way that we're doing that is essentially taking a look at all avenues for wholesaling. So not only are they bringing in their medications through wholesalers that they've already got relationships with, but we're bringing in other relationships that we've made and connected with wholesalers to create kind of a marketplace of, and we find this drug at a better price with a different deal.
Yeah. That's awesome. And yeah, you're right. It just depends on utilization. It depends on different things impacting the businesses that they're working with. But there's tremendous savings there where and the cool part is, those savings, even the part that's not being saved stays within the local community and helps support the local community. Okay, so we talked about this a little bit, that you've got a footprint already in a few areas, but not having a footprint doesn't stop a broker from being able to kind of put a strategy together around using this model, right? So
100%.
if I'm a broker and it doesn't exist if it does exist where I'm at, great. I can put my self-funded clients on it, tap into that PBM, and it will work perfectly. If not, I've got to strategize on, okay, what are the clients I can go win right now with this strategy and get that basically hub, right? That PBM that's going to be that health center, and get them on it, and then start to use that to solidify the book of business that I have, but also win new business by making those costs a little bit more competitive. So yeah, I love this idea, and I think it's really, really creative. So you mentioned that Wellyfe creates a local care advantage. There's all of the people in the chain here are local, right? How does that improve patient experience for employees at these employer groups? And how does that translate into employer savings and ultimately, hopefully, employee retention for these customers of our brokers that are watching?
You could probably have two different conversations with the same person, whether it's over the phone or through a video chat, and you can get a different message. They could be saying the same thing, but you're going to get a different message either through the phone or through physically seeing them. It's because when we communicate as human beings, right, there's more than just words. There's tonality, there's gestures, there's facial expressions. You're missing all of that within that kind of really intimate relationship with like a healthcare provider. So unless you've known someone for years and you know that they're saying something and they have the certain tone, or you can see their face while they're saying it, you're not going to have that responsiveness to an individual who is supposed to take care of you, right? Now, we can see this happening in a number of different ways and within the pharmacy benefit world, where it's mail order only. Specialty pharmacies are held kind of close to the chest. It's a entity or a PBM owned specialty pharmacy that you have to utilize. It's hard to feel like they actually care, right? So when we strip that away, we use kind of that vertical integration against the bigger PBMs and kind of focus it back into the community. We're going to see fewer ER visits. We're going to see higher adherence to medications. We're going to see less friction for that member. I don't have to call someone in a different 3 states over to try to figure out when my drug is going to get here. I could pop by the local pharmacy and say, "Hey, I know it's probably shipped already, but wanted to see if you guys had the tracking information. I know you guys are busy. I tried to call, you didn't answer X, Y, and Z." You have the ability to actually walk in. And then finally, you're going to have fewer angry emails to HR, which HR appreciates. Sometimes they get the brunt of, "Well, I'm just having a terrible experience with my healthcare. I'm having a terrible experience with our benefits." Are our benefits really benefits? Because I feel like I'm being tugged in 15 different directions. I'm jumping through all of these hoops. We're able to really kind of just reduce all of that. Because again, just put yourself in that individual's shoes, right? If I'm going to have to, call 6 times to a pharmacy that's, maybe not open because it's in a different time zone to figure out where my important specialty medication that's very expensive, is it shipped? Is it lost in translation? Is there a snowstorm? Is it, so cold out that I'm worried about it freezing? There's lots of anxiety that causes for a member.
Yeah,
in terms of the healthcare experience.
definitely. Keeping that, some communities are small enough that you know the person that you're talking to. That's not always.
Mm-hmm.
Um, yeah, having that be an actual person that you can stop in, have conversations with, that does help with bottlenecks that can be really frustrating in um, bigger chains, mail order, that kind of things. Uh, Super helpful. Let's talk about geographic limitations. A lot of brokers that are watching this will have their book of business spread across multiple states, right? So if they're all in one city, that building that health center to be the PBM, and then getting all of the local businesses on board with that makes a whole lot of sense. But if I have some customers in Utah, some in California, some on the East Coast, how does Wellyfe work for that type of book of business? You'd mentioned having a wrap network. How does that fit in and ensure that there's coverage for all of those different clients?
Of course. So we run kind of a 3-tiered network, right? So our baseline network, or that tier 1, that's going to be your cheapest for employer and employee, is going to be essentially that hub, right? Wherever that hub is. If that's the health center, the hospital, wherever that's at. So if that's in Utah, but you got individuals in California, you're going to have some issues getting essentially to that care, right? So there's mail order options. Or 2, there's kind of that secondary and tertiary network, right? So secondary network is going to be your independent pharmacies that are within the area that you want to have a relationship with. So you could even extend that across state lines to say, "Hey, we're going to have a conversation, or we're going to fill a prescription with a local independent pharmacy of an individual who lives in California." We can totally do that. And then the third network is really a wrap network, right? It's a national 67,000 different pharmacies in that network. And that's really for, Adam, if you're on the plan and you're visiting family in a different state, let's say you're in Ohio instead of Utah, your health center, your hub isn't anywhere nearby. We don't have a secondary network option there in terms of an independent pharmacy. You still have access to getting a medication, whether you got sick during your trip, right? You need an antibiotic quick, or, you forgot your medication at home. You still have access, right? You're going to pay a little heavier of a copay, right? And so is the employer. But at the end of the day, you're still going to have access to that medication, which as a pharmacist, I think is the most important thing. PBM shouldn't be trying to, restrict access to medications, right? We want to make sure that we have the right access for the right drug at the right price.
Yeah, that's really, really Interesting. So let me make sure that I'm understanding that right. So if I'm a broker that has a client in Utah that's self-funded and I've got one of these stood up in California, we can actually still have the Utah business using that California hub that we've built to fill medications. So the wrap network is really only if I'm on vacation somewhere and need a prescription filled quickly, right?
Yeah, exactly. And I think, by the time we hit 2028, 2029, we're going to have enough hubs kind of across the United States that essentially that third network is going to be us eventually, right? We'll be able to just say, okay, well, I'm in Ohio. Let me find the hub. All right, it's at X, Y, and Z. I'm close to it. I mean, we'll still have that wrap network as an option, but I don't think it's going to be utilized very much going forward. And again, we're talking about like 1% of the claims right now, right? When we have our total book of business, we're seeing a few claims that are going through because again, they're on vacation, lost their drug, forgot it at home. I mean, we've all been there. You rush, you're late, you wake up late, like home alone, trying to shuffle your bag together, get your stuff in for a business trip, and you forget your meds. You forget X, Y, and Z. Luckily for me, I'm not on any actual meds. I'm just on like, over the counter stuff. So I can just run to the airport and get it there, although it's way overpriced there. But, at the end of the day, it works. I still have access to.
Yeah. Okay, I'm gonna ask one question that's kind of asking you to predict the future, right? So
Hmm.
we have there's a lot of noise around this space right now. I think Mark Cuban is driving a good amount of that. He's been pretty vocal on PBMs and the need for change in the PBM space. You've had unprecedented growth this year, which obviously, as we talk through this and how beneficial it can be in employer health strategies, it makes sense why you've had the growth that you've had. But predict the future of PBMs for me, just kind of 5 years from now. Where do you see that changing? What's driving the change? And how does Wellyfe fit into that?
Wow. Let me just grab my crystal ball real quick.
Yeah.
So 5 years from now, I think, we're seeing more manufacturers go direct to consumers. So I have a feeling that more manufacturers are going to start tapping into direct to consumers, but also maybe direct to employers. So they'll sell their drugs directly to employers. They'll kind of eliminate having to do the whole rebate system. They'll eliminate having to really aggregate, um, you know, claims within certain PBMs. I think that, well, I'm hoping that we have actual transparency moving forward, right? Being on the other side of things and hearing organizations talk about their transparency and then reading their contracts, I scratch my head. I'm puzzled. I'm like, you're saying one thing but doing another, right? I think where Well fits into all of this is that, you know, we're hoping that we can change how PBMs work within the United States. We know that the average American is struggling, and I've dealt with this as a pharmacist. Do I pay for my meds, my food, or my rent, or my housing? That's not a question that someone should have to ask, especially when you're seeing in the news, a drug that was made for $6 is being charged at $6,000, and all of that is just essentially fluff, profit. So for us, right, we want to, of course, we want to continue to grow, continue having our model that is what we call direct pharmacy care, having communities really be able to build essentially these kind of just mini powerhouses for their economies, right? We also want to maybe start driving some change within the industry as a whole to getting towards more transparent practices, getting more towards it making sense,
Yeah.
period, right?
Yeah. I think you hit the nail on the head with transparency being the direction that it's going. And I think we're seeing that, this year was unprecedented increases in premiums to almost every single employer. And I think that's driving a lot of questions that people just didn't care to ask before, a 4% increase. It's like, okay, it's 4% increase. A 50% increase, 100% increase. It's like, well, okay, now I got to ask the questions, right? So we're getting a lot of those questions. And this one is probably the hardest for most to answer because it's purposefully vague. It's purposefully vague because there are tons of hands in the pot, and you're bringing clarity and visibility to that, right? With your cost plus model that you're working with these PBMs. That's where the savings is coming in. So I see this as a huge opportunity, and you're in the right space at the right time. Definitely. Any broker that's watching this, I hope you take the time to reach out to Dr. Jonathon and talk about what the potential is with your book of business, because there's a huge savings potential. There's a huge transparency potential, and a lot of business to be won with this. So before we wrap up, I love asking people this, but you're pretty involved in the employee benefits and health space. What has you most excited about being in this space in 2026 and going into the next few years?
I think we're starting to throw away the old playbook. Organizations and employers are starting to wisen up. They're starting to listen to the education that's out there about, we can throw away the old sign that this is always how we used to do it. So that's how we're going to continue to do it. We can start looking at new vendors. There are so many PBMs out there, but in all actuality, right, picking the right consultant to walk you through that path to pick the right vendor partner, because this is truly a partnership, right? All of our clients we're considered partners with because we've got their employees' lives in our hands, right? When we're talking about access to medications, we're talking about making sure that they're getting the clinical support that they need so that they can continue to take those medications and have the health outcomes that they're hoping for. At the end of the day, that really is what is most important to us. And I think that that's what's most exciting about 2026 and beyond is that, because of our tremendous growth and the things that we've been able to do this year, which, we're very thankful to our current partners, and we're excited to meet our new ones that are coming on in 2026 and in 2027. We've even got some that are ready to go for 2028. We've had these conversations that, we're ready for something different. And everything else that's being told out there is, oh, we're so different from everybody else. It really isn't different. This truly is. This is a model that is essentially an alternative to the traditional PBM model, right? And direct pharmacy care is here to stay.
I love it. I love it. Thanks again for joining us today. If you're watching this and you didn't take something away that you could do tomorrow, you need to listen again, because there's a lot in here that as a broker you could use to help grow your book of business. This has been another episode of Benefits Broker Boost. Thanks for taking the time out of your day, and be better tomorrow than you were today.